it's really when we start thinking about the value again and saying, you might argue with me on I can get 10% more registrations in the portal or 2 or 3% more colon cancer screenings. I'm happy to have that discussion all day, because what I know and what the data has shown us is treating letters with behavioral principles will have a positive pull on the population in some way, shape, or form. And when we start talking about actions like prescription drug adherence or in-home assessments or colon cancer screenings, the value of those actions to a health plan are so high that even if only another 500 people or 1,000 people, but in many cases a lot more, are doing that, the value we can create with that same spend all of a sudden starts to become really strategic. And this is, the numbers, again, you argue with me, that's completely fine. The intent is to say, are we extracting the most value out of our correspondence opportunity? Because anything we gain here, one more person doing an action, triggers towards the positive ROI with it. And just to be clear on that, I think we could look at these treated letters and we could say that really feels like a creative services exercise. That feels like if we got a graphic designer, that we could make the changes that we're talking about. At Clarity, we want this to be rigorous. We want to say, look, we did 2 versions, not just from a which one looks prettier, but which one was introducing a new element of behavioral science. And can we prove that that was more effective? And where I think this gets really interesting, and I know when Scott and I are talking about where Clarity is going, it's why we're so excited. If you learn that a particular principle was really effective with your population, that's not a learning for an ID card. That's a learning about your membership. And that's something that you can start to say, if I'm at on-site events, if I'm sending another type of letter, if I'm sending a birthday card, like I can start to understand what's going to be resonant with them. So I pause on this one just to say, as we do this, and for many of you out there that are already engaged in working on accelerated member engagement with us, you'll start to see dashboards around what worked and for whom. And that's really something that we want to be the deliverable just as much as the treated letter that we think is going to have that heightened attention with it. So we've given you guys a lot. We wanted to introduce, I think, one more poll. So April, if you can help us with this. As you've listened both to what Adrian and Scott and I have shared, we're interested in just what we feel the starting point is. And so when you think about writing that correspondence or what the member communications look like today, questions up on the screen, but how confident are you that you really are leveraging and leaning on behavioral science to drive engagement in and up above just sending the correspondence at all?